Lupus by Shelby and Michaela. Lupus, also known as SLE, is a connective tissue autoimmune disorder. This is where the body attacks its own tissues. There is no known cause for lupus, but scientists think that there is a connection between genetics, environment, hormones, and the disease itself. There are many symptoms, some of which are fever, malarash, and nosebleeds. There is no cure for the disease yet, but there are some medications that patients can take to help treat the symptoms. What is lupus? Lupus is an autoimmune disease of the connective tissue of the body. Lupus is a chronic multi-system and occasionally life-threatening disease. In autoimmune diseases, the immune system fails to distinguish between a foreign object and self and attacks the body's own tissues, causing damage and inflammation. It has environmental, genetic, and hormonal origins. It affects more women than men. Many scientists believe that there is a link between estrogen and lupus. It usually affects women that are of the childbearing age. They also found that the symptoms are much greater during pregnancy and before menstrual cycles. Even though both men and women produce estrogen, women produce more. It is distinguished by a rash on the cheeks and on the bridge of the nose called the butterfly rash. There is no cure for this disease yet. There is no gene that has been found that causes lupus, although scientists think there is a link between genetics and lupus. It is estimated that 25 out of 100,000 people have this disease. Symptoms of lupus. There are many signs and symptoms to lupus. Some can be life-threatening. No two people have the same symptoms. Symptoms may develop slowly or happen rapidly. Symptoms may worsen due to triggers. Triggers are ultraviolet rays from the sun or light bulbs, sulfa drugs, which make a person more sensitive to the sun, diuretics, sun-sensitizing drugs, other antibiotic drugs, infection or cold, exhaustion, injury, emotional stress such as divorce, illness, death in the family, or other complications, and anything else that causes stress to the body, such as surgery, physical harm, pregnancy, or giving birth. Symptoms may be temporary or permanent. Symptoms appear in flashes. This can affect any parts of the body. Some may have a few symptoms, while others have many. Some more symptoms of lupus include nausea, malarash or butterfly rash, fatigue, fever, arthritis, shortness of breath, chest pain, dry eyes, headaches, and Raynaud's phenomenon, which is cyanosis or the turning blue of fingers and toes due to stress.
Diagnosing and treating. Lupus is not curable yet. It is difficult to diagnose. Autoimmune diseases are individually rare and poorly understood by clinicians. They appear to either be systemic, such as in lupus, or organ-specific, such as in type 1 diabetes. Diagnosing SLE can be difficult because there are no definitive tests for diagnosing SLE. SLE can mimic symptoms of other diseases, making it much harder to determine. Laboratory tests are the most helpful in diagnosing lupus. SLE patients commonly have elevated levels in some antibodies such as anti-nuclear antibodies and anti-DNA antibodies. SLE patients tend to have low numbers of red blood cells and white blood cells. No single test can determine if a patient has lupus or not. A test called LE-PrEP test is performed on the blood samples. The blood sample separates the damaged cells and a stain called right stain will cause the damaged parts to turn blue, indicating the disease in the blood. When this test is performed, 70 to 80% of all patients will show a positive test. To diagnose a patient, the doctors might obtain a blood sample, complete blood count, urinalysis, skin biopsy, and kidney biopsy. Patients with lupus need to be educated about the certain viruses that could affect symptoms of the disease. Lupus is a disease that can be survivable, but is important to look for signs of kidney damage, psychological damage, and neurological damage. Treating lupus is a team effort. The treatment of lupus depends on the organs affected by the disease and the severity of the disease. Some medications that patients with lupus take are NSAIDs for pain relief, anti-malarials, corticosteroids, immunosuppressants, specific inhibitors, and therapies. Those that have mild symptoms of inflammation can be treated with over-the-counter drugs such as Motrin or Advil. The more severely ill patients with potentially life-threatening complications such as kidney disease, pericarditis, nervous system complications will require treatment with more potent drugs, including steroid medications, drugs that decrease the activity of the immune system, and may also be used for severely ill SLE patients. Some alternate treatments like stress treatment, diet, and exercise can also help. A support group can also be beneficial. Prevention of lupus has yet to be figured out, but those newly diagnosed can lessen severity of flares by educating themselves on diets, exercise, and signs of flares. Although we know little about lupus, steps have been taken to understand this debilitating disease better so that we can give patients a longer, more comfortable life.